Yeah, so when I was a first year medical student at Cornell, you know, you come to medical school and you're so excited about trying to make a difference and or get this skill set that's going to help you take care of patients. Yet, as soon as you arrive, almost immediately they put you into the classroom and you have didactics from morning till evening. And so this was just an avenue by which we could keep a vibrant, alive connection with what we were really after, which was just to make a difference in people's lives and to see on an almost regular basis the people who we were helping. So I would say a succinct answer would be to keep passions alive about why we went to medical school in the first place.
Why it's so special. Yeah, so the Women's Health Clinic started about 5 years ago as an offshoot of the regular medicine clinic because we realized that we had all these female patients who really needed gynecologic care and they weren't able to get it anywhere. And so we really saw this need in the community and we kind of created it as an answer to that. And it started off kind of on a smaller basis and has now grown into a really strong clinic that runs every other week and a really important part of our patient care here.
How much would you say mentorship plays a role in your role as a director for the Women's Clinic?
Yeah, so we're really lucky to have a fabulous attending, Dr. Patricia Allen. She's been with the Women's Health Clinic since it started 5 years ago. She's incredibly dedicated. She comes to the clinics every other week and has been doing that for the 4 years that I've been working with the clinic, which not only provides for great mentorship for us as students, but really great continuity for our patients. And it's really important to them as well. And so she works really hard to make each clinic informative, educational, engaging, but then also to really kind of make sure that our patients get everything that they need here. And we're really kind of a great women's medical home.
Each of the medical students is exposed to wonderful doctors in all of the specialties as they go through their clerkships, but often they don't have one-on-one teaching. In this clinic, we learn how to work together as a team. The 3 co-directors run the clinic. I'm their advisor. The junior clinicians teach the first year clinicians, and I'm present for the exams, and I'm present to check on the history to make sure that a little wisdom that I might bring keeps us from missing something important. The clinic has not changed all that much, except that we now have, for the last 2 years, 3 co-directors. And we need that because the volume in the clinic has increased and the co-directors do need time for interviews and spending clerkships outside the institution.
Thanks. And can you talk finally just about what motivates you to keep doing what you're doing and working so extensively with the clinic?
Someone told me once that the best way to have a fulfilling life throughout all of life's stages is to make sure that you have relationships with people of all ages. So I have friends and colleagues in their 90s and their 80s and their 70s, and I have my wonderful relationship with the students.
The medical director and faculty advisor for WCC, which has been a real pleasure and something that I enjoy immensely.
How does the WCCC help patients?
So first, who are the patients of the WCC? There are people who throughout the New York area don't have access to care. So that includes people who both could get care but don't know how to go about it, and people who really can't access care. And our patients come from all the 5 boroughs. They come from far away some of the time, and they're all people who have great medical and often social needs. And what's wonderful about this is it provides students an opportunity to meet these people where they are, to learn about them, to learn about what the challenges to getting their help is, and what it allows us to do is provide them substantially more support than would be available in many other settings. So that includes not only getting medical care, but having financial help to afford your medications. And for some students, they become a continuity of care student. So someone who might be complex or have high social needs might have a student contact that is theirs for a couple of years.
Well, I think one thing that's really awesome about the WCCD is that we have a site clinic at all. So basically we serve as a consult service to our primary care clinic, the medicine clinic. And so we'll see patients, when they see patients who usually present for medical complaints, but then will also complain of depressed mood or anxiety or something else psychiatric, they can refer them to us and we can kind of evaluate and decide whether or not they need further treatment for any psychiatric disease.
So what is the clinic like every Monday night?
So every Monday night we pair up some junior clinicians with our senior clinicians, and junior clinicians are first or second year medical students, and our senior clinicians are third or fourth year medical students. So I think that the clinic really provides a great platform for peer-to-peer mentorship. The junior clinician gets to practice all of the things that they've been learning in the classroom and apply it to real patients. And they also get to pick the brain of the senior clinician who they're paired with. And then the senior clinician gets to teach and to solidify their clinical knowledge through teaching and also provide mentorship to the junior clinician. And it's actually through that, being a senior clinician, through that experience, that I found out that I like teaching too. And I'm hoping to dedicate a significant portion of my future career to medical education, and that was all through the clinic. And honestly, I have so many good things to say about the clinic. It's where I learned how to become a teacher, how to become a peer leader, and ultimately I think it's the place where a lot of us realize what it means to become a physician.